Right, morning everybody. Friday morning, Friday evening, depending on where you are. I'm going to just put the chat on my Q&A up on my screen so I can see everybody. It's Friday morning, so if those joining, if you could pop your name and where you're from in the chat so we can see who we've got and how we can address any concerns and questions. What we normally do on these kind of sessions is anybody who's got a question, chuck it into the chat, and then we'll pick those up as we go along, and we'll get Jackie and Rob and Claire to answer them as in the relevant format. So we'll go and get into the session, and we'll do intros first. So the session here is to talk, as I said, talk about how Medway have taken an approach towards proactive technology and what the savings and the specifics that they've done to put in place. I think from my perspective, having worked with the team over the last 18 months or so, it's been a really good journey. We've had lots of learns, and I think what's for people to take away from this call is actually, when I talk to local authorities, lots of people want to do everything themselves. And actually, what I hope you'll get from a sense of this is that you actually need a partnership approach, and you need people in place to be able to deliver. And I think that's what you'll get a good sense of. And when you do that, and when you put those pieces of the jigsaw together, the outcomes can be great and they can be really positive. But it's also about taking a strong approach internally and having that leadership and that ownership, which we'll get into in a little bit. So let's get into intros. I'm going to go left. We'll go across the screen on the panel. So Jackie, let's if you quickly introduce yourself.
Yep. Morning, everybody. I'm Jackie Brown. I'm the Assistant Director of Adult Social Care here at Medway Council.
Excellent. Claire?
Hi, everybody. I'm Claire Burgess, and I'm the Chief Exec of Kindy, which is a LATCO wholly owned by Medway Council.
Brilliant. Rob?
Hi, everyone. I'm Rob. I'm the Head of Sales and Business Development for Kindy.
Excellent. And do we have Rhiannon? Can't see her.
Yes, we do.
There we go, Rhiannon. You're not on my screen.
Oh, sorry. Yeah, I'm
Sorry.
Rhiannon. I'm the Key Account Manager for Kindy, and I am based at Medway NHS Foundation Trust.
Excellent. Brilliant. Right, let's get into it. So, look, I'm going to set the tone, and we're going to get into some of those conversations. So, like all councils, Medway, not unique in the challenges it faces, and not unique in terms of the challenges that all the sector as a whole is facing in terms of increasing aging population, challenging budgets, increasing pressure, capacity in both the home care and in hospital situation. And I was just saying previously, before the call started, the CQC have launched their document, the State of Care, literally about 10 minutes ago. So I'm going to read this because I think these are the key findings from the CQC report. So key findings around adult social care, increase the number of new requests for local authority support was not matched by the number of requests granted. So what that means is that the number of new requests that did not result in a service being provided is increased by 27% since 2017. In April 2024, the wait for care home beds and home-based care accounted for 45% of delays in discharging people from who'd been in acute hospital for 14 days or more, with nearly 4,000 people delayed on average every day. For much of 2023, the North East and North and Yorkshire had the highest proportion of delayed acute discharges waiting for home-based care, and the North East region had the fewest number of home care services per 100,000 of population. London had proportionally the most delayed discharges from acute, waiting for care home, and the fewest residential care home beds per 1,000 population. But in positive, at 5.4%, staff bases in care homes at the end of 2023 were the lowest rate they've been in the last 3 years. And increasing international recruitment showed signs of levelling off in 2023. And there's been a steep fall in the number of overseas workers applying for health and worker visas, representing an 81% decrease in the period April to July 24 compared to the same period in 2023. And so those are the key factors that the CQC are publishing today. So we know the market challenge. We know the state of the market. But Jackie, can you just give us a sense of the challenges that you were facing as Medway, and you know, and what you wanted to, how you wanted to address those challenges?
Yeah, absolutely. So I think just to give a little bit of context about Medway, for those of you that don't know, so we ultimately are a unitary authority that sits in Kent. So we are surrounded by Kent County Council. Being a unitary, I have to say, is fantastic. We are very agile and mobile, and I think, you know, that's helped us with what we're talking about today because of the ability to move quickly. If I just give a bit of context around numbers, we've got just under 280,000 residents in Medway. It's been about a 6% increase since the last census. As Nick's alluded to, obviously seeing the numbers of our demographics increasing. So we've had a 24.3% increase in people over 65. And then 8.6% of our residents say that they provide weekly unpaid care. It's anticipated that by 2040, that we will have an additional 11,400 people in Medway. And we're also expecting between 2023 and 2040 that there's going to be a predicted 38% increase in the number of older people with dementia. So obviously that trajectory is you know, ever increasing. That is obviously having an impact on our budget. So from our point of view, we support around 6,500 people. About 3,000 people have long-term services, so long-term care and support, whether that's home care, residential, nursing, supported living. And our safeguarding numbers have increased. So safeguarding concerns have increased by 73.7% over the last 5 years. So just that gives a bit of context of the numbers that we're sort of dealing with. Our home care numbers are increasing month on month. Nick's just alluded to the delays of hospital discharge. We're very fortunate in Medway that we don't have that problem from a home care perspective, pathway one. You know, we're very quick and able to mobilise, but we have a significant lack of beds in Medway. So I received the data yesterday about our number of contracted beds, and we actually have, they're all full. So we've got no residential nursing beds available in Medway at all. With regard to budget, in 2023-24, our gross spend on adult social care was 139.5 million, and that was up from 124.8 million in 2023. So a significant jump. And so obviously from the financial challenges that we face as a council, as I'm sure a lot of you on the call do as well, we were tasked with delivering savings. And for adult social care, that equated to 8.4, just under 8.4 million pounds. Things aren't great either this year. So at the end of our Q1 budget forecasting, we've seen another increase, quite a significant one. Things just continuously, that demand that we're seeing is continuing. But I think actually more than the demand is the complexity of the people that we need to support, and talking to other colleagues in other local authorities, in public health departments, you know, everybody is, I think, seeing something very similar. So we needed to do something. Delivering just over, you know, 8.5 million is a massive pressure, and we needed to change our approach. So I think Rob and I probably have worked together for, it feels like a million years, probably from Rob's perspective more than mine. But we've worked together in, you know, as Kindy, in Kindy's former guises, with the usual assistive tech. So, you know, social workers would talk about falls monitors, alarms, etc. But the feedback from staff was that they didn't know what was available. So prior to Claire joining, I would have meetings with her predecessors, and I'd say, you know, what's out there? Let me know what's out there. And they'd say, well, tell me what you want. And I'd go, but I don't know what I want because I don't know what's out there. And we'd end up in this continuous stalemate. And I think it was probably frustrating for everybody involved. And then embarrass Claire now, but Claire arrived new into the post. We met, we discussed the situation. I think the fact that we've got a really good relationship as well, that makes a big difference. We're both very passionate in our roles. We both want people to be independent. We want them to be home as long as possible, and something different had to happen. And Claire's approach was, we'll start researching and we'll let you know what's out there. And then by chance, I met Nick at the ADAS conference. I think we were both at the bar, and he contacted me afterwards, and I passed him his contact details over to Rob and Claire. And I suppose from that point of view, you could sort of say the rest is history, really. So the guys from Lily came down and did a presentation to my teams. I'm going to be very honest, at the beginning it didn't work particularly well, and we were all a little bit like, oh my goodness me, how are we going to change this? But Nick did come in and made sorry Nick, embarrass you as well, but Nick came in and was like, we need to change this. You know, the first way of working isn't how we normally do it. And I have to say, turned things around really, really, really quickly. So obviously, you know, Rob and Claire will go through a bit more about the conversations that they had. But what we talked about was the culture change that was needed in adult social care, and how did we move people away from it just being about false alarms and monitors and so on and so forth, and do something different. And I think the first time that I mentioned Lily to somebody, they sort of looked at me as if I was completely loopy, one of the team. And so we had to sort of do a bit of a discussion and explain and almost say to them, look, come on, just give it a try. So we have a best practice forum. So basically any care that is £400 a week and over, the social worker comes and they talk through what that looks like. And we invited Kindy to join our best practice forum. So that they're here, they're there listening to what's going on and can say, actually, have you considered this? Generally speaking, Rob's on the call or Rhiannon's on the call, and I look at them and I can see them looking at me, and we know that potentially that could be a bit of a Lily going in rather than somebody going into a care home. So we're on that same wavelength. We've also got a member of Kindy's team sitting at our front door. So it's just that mindset of getting people to think very differently. And I think by doing that, and by the assessments that Lily provides, so the information that it provides, has made the teams think differently, because it absolutely demonstrates what's going on in the individual's life. So if I just give you an example, we had somebody came to our forum to say, you know, we've got a person who's under 60, not going to go into too many details, with a lifelong condition, and they need to go into care. Never had any care at all, not known to adult social care. And when we got to the bottom of it, it was very much family driven, and the family saying that we need to move this person. So we made the suggestion that actually we put a Lily unit in, with some home care and some support, and that made a difference, and it was able to demonstrate that that person did not need to go into a residential care home, and actually continue to have and lived at home with some care. So obviously once that message started to get out across the teams that this was able to support those assessments and the overall assessments, it also led to us having robust discussions with families. So a lot of you will know that there's a decision, people will make the decision that they want their loved one to be in a home or to have a form of care, because they are saying to us, this is what's happening at night time, or so on and so forth. And again, we were able to demonstrate from the Lily unit that that wasn't the case. It also enables us to have some conversations with providers. So an example being told by a supported living provider that somebody needed 24-hour one-to-one care, put the Lily unit in, and it demonstrated no overnight care was needed at all. And so it's been really useful across the board, I have to say, because it isn't just necessarily about the savings, obviously a significant part of it, but about that least restrictive approach. You know, the idea of having somebody sitting with you 24/7 when you don't need it, it's enabled us to work in a different way. There's still a way to go. Claire and I were having a quick catch up this morning. We know that there's still a way to go, but I think the fundamental part for us was absolutely needing to think differently about how we worked to get our teams on board. And if we hadn't have done that and hadn't have made those changes by having, I would say, the Kindy team almost feeling like a part of adult social care, I don't think that it would have worked in the way it has.
Brilliant. Thanks, Jackie. That's really, really good and really detailed. And hopefully everybody who's on the call is down there scribbling notes and understanding and taking the feedback for their organisations. Claire, given the set of challenges that Jackie's kind of outlined and the approach and the needs that Jackie had, how do you drive Kindy, and how do you work, create that relationship to drive the outcome for the council.
Yeah, and I think Jackie touched on it, Nick, really. It fundamentally, we needed to have a really good relationship between all of us, and trust. And as Jackie explained, I was new into role, so my first priority was making sure that I built that relationship with Jackie and we built that trust between the teams. We spent an awful lot of time discussing Jackie's challenges, how we could work as an organisation in a different way to support her. And then I spent a lot of time with my team to see how we could then progress those relationships. One of the challenges was that we weren't as visible as perhaps it could have been. And I think, again, Jackie mentioned that now the teams are much more visible. So we do attend the panel. We also recruited what we've called a tech champion, who sits at the front door, and she's literally talking to everybody around new assessments and reviews, and making sure that assistive tech is at the front of everybody's minds. And it was very easy for us to just say everybody needs to have a tech first mentality, but we had to demonstrate that, and there had to be commitment from me, from Jackie, and also from our elected members. And we are really fortunate that the portfolio holder for health and social care at Medway is also very passionate about health and social care and supports both Jackie and Kindy really strongly in relation to assistive tech and can see the positives. We also needed to people think about assistive technology, and there can be a bit of a fear factor for lots of different people for lots of different reasons. And we needed to make it clear from the very beginning that assistive technology is not there to replace people, and it should not be thought of to replace people. But what it can do is support the people who need to deliver good quality face-to-face care to be able to focus on what they do, and let assistive technology pick up the bits that assistive technology can support with. And again, it was getting the message across that yes, there's cost savings within this, but actually there are people at the end of this who in most cases are pretty vulnerable, and making sure that they are at the forefront of everything that we're doing, so that people didn't just think we were just doing this to save money. Yes, there are substantial, and we've proven substantial cost savings. However, there are other benefits to people, and as Jackie mentioned, people are being able to live independently and at home for longer than they perhaps would have done previously, and that for us is really important, and that message was really important for us to get across.
Brilliant, thank you, Claire. Rob, I'm going to come to you in terms of talking a bit about the operational piece and how that's kind of works. But there's a question's come in, and I think you're probably the best placed person to answer this, which is, can you just explain the Kindy structure and how Kindy works and how that kind of fits into the whole piece?
Yeah, of course. Kindy are the local authority trading company from Medway Council, so we're 100% owned, but we sit just outside the council. We provide assistive tech and CCTV, but the assistive tech is a driving force at the moment. So we're able to act in an agile fashion with regard to new products, but also be embedded within social care, as Jackie was talking about, and Claire alluded to, that we're able to be moved into that facet, and we can move people about a lot quicker where there's required need, and then do a joined up approach basically.
Excellent. And then just back to the kind of the topic, you're at the sharp end of that delivery. What's been your experience of working with Lily, and the kind of what's hopefully set us aside from other providers?
Yeah, of course. Well, the main driver of this is not just to get the Lily assessment tools out, because anybody in Jackie's position, she could raise an edict that says, right, everybody who's over £400 needs to have a Lily go out. That's fine. You can stick 150 out into the field, and if you don't do anything with them, you don't get any results and you don't get any communication, and they sit there and they come back and you don't get any savings. So we needed to invest time as Kindy, with Jackie's support and support of our board, to go out, basically put them in, and then continue the process over. And because of the time that's devoted into bringing that process, the communication, the discussion of what each report is showing, discussions with family, discussions with social workers and the family, the support of Lily is key, because we can't do that all ourselves. We simply don't have enough time. In essence, if I need something that's Lily related, I know I can pick up the phone to Nick or his team and just say, can you do this for me? Can you do that for me? Can you amend the product that it shows this now? Or are you able to encapsulate that? Now, Nick then pulls his hair out and calls me a pain up the proverbial, but tends to do it for me and smiles nicely and still takes my calls. But it's that partnership. It's the fact that they will come down and they will have a chat. They'll invest resources in to promoting not just the Lily service, but the service that you're trying to promote to your guys that are on the front line.
Brilliant. Thanks, Rob. That's very kind of you. Yes, and obviously, yeah, we want to work with organisations because actually, unless we build the right things and give you the right tools, then it doesn't work. So we need that kind of understanding. Rhiannon, I'm just going to ask you quickly, kind of as somebody who's working, as you say, within the hospital team and understand and using the technology. What's been your reaction to, as Jackie said, that driving that culture change and being the kind of that point of use and being really driving the conversation with both the friends and family, but also the other practitioners and yourself?
So I feel on both parts really, with adult social care as well as family members, it's useful to both because it builds a picture for both parts to establish exactly what is going on with that person. And again, like what Claire said, we're all here for the same thing. It is very much person-centered because we want to make sure that we're doing the right thing for them. So we can evidence that by building reports and showing adult social care what's been happening, whether the person is managing or not managing so well, and we can also show that to the family as well. It's great as well the fact that there is an app, so we can also offer that to family members too, so they can also keep a close eye. And the fact that it is so time specific, which I think is really important. But yeah, we've had really good feedback, and the social workers here at Medway, when they assess patients prior to the discharge, they will look at the Lily, and we will do that assessment together to establish whether it would be useful to them, and then we'll put it into place and see what's happening. So it's really good, very positive.
Great. Right, audience participation time. So we're going to put a polling question up for yourselves, which is, are you currently considering a digital solution for your organisation? And just a little bit of insight there. I think from my perspective, it's great to hear from the panel there in terms of the values and the different kind of tiers of value that we're delivering across the service. And it is absolutely about, from our perspective as a tech provider and a solution provider, building that whole picture and saying, actually, what's the outcome we're trying to achieve, and how does our tech help you get to that outcome? Not here's the tech, work out how it gets that outcome. So we need that insight. We need that partnership to be able to say, actually, and it comes down to things as simple as, are we using the right language on the platform so that when somebody looks at that actually is giving them the insight and the context, and it's not some corporate word, but actually it's the word that they're relevant to. So yeah, it's really important that the relationship between ourselves and our customers and our partners is that symbiotic piece that actually drives us all collectively towards the single goal of keeping people in their own homes for longer and being able to then measure those outputs. So give it another couple of seconds to do. And is it Lauren? Are you doing the results? Pop the results. So I think, so the results are really interesting here. So this comes back to the point that Jackie was making at the top of the call, which was that conversation between what's available, what does it do, don't know what we want, how do we pull all that together? And 41% of people on the call have said we're still researching the benefits. So hopefully this call is going to help accelerate that ideas of what the benefits can be, and kind of give you some insight, because that we all need to move forward as a market to create the right outcomes and give people the confidence. So right, let's move on. Next slide. So talking about implementing the tech. So I'm probably going to go to Rob first in terms of this question, because I think this is an operational. So, how did the approach to implementing the technology come within the organisation? Were Jackie's alluded to some challenges that we had kind of between ourselves and actually us changing the way we worked and saying actually we need to support you in a better way, and how can we do that? But kind of those operational challenges, Rob, what were they, and how did you overcome them as the delivery arm?
The best practice panel was a real eye-opener, that how that led to not only the installations for the assessment tool within the people that were on the panel, but for other clients that were sort of on the social care radar as well. It did take about 2.5 months, I'd say, Jackie, but what we're seeing now is that people are talking to Kindy about the assessment tool and in fact about all tech before they actually take their case to panel, which is a bit of a halcyon thing for someone who's been doing this since God. But it's sort of that, then them saying to us, well, what would help, us then confirming what would help, and then going to panel. So we're sitting there going, well, yeah, Kindy have already reviewed this case, they've already had an assessment, then let's take it from there. So that is a real sea change, and it's almost like people in a team, locality, are seeing the benefits because we are pushing the benefits at them, and they're taking it on board, but they are then feeding that back to the other members of the locality, and it becomes a snowball effect, so that yes, we're getting referrals in, but they're not being driven from the top anymore. They don't need to be. It's being driven from the ground up, which is fantastic. I mean, the actual process itself is the install, which is fine, and then it's the constant communication. It's having the knowledge up front as to what is the challenge, why that person is felt that they need to either have an increased care calls or they go into a residential setting. To have that knowledge means we can place the sensors in the right place, and it means we can focus our commentary upon that. Then once we've had the unit in for 3 weeks, a month, we can pull the report together, and then we'll either sit down with the people, we'll run the report with them, we'll show them the report, and we'll talk it through with them. The report speaks for itself, but sometimes you just need a bit of background on it, and that's what buys it in, and that's what buys the family in at the outset as well. If you say to the family, because a lot of the times the family will be saying, no, my loved one needs to go into a care setting, they're not safe. So the argument back on that is a real straightforward one. It's like, okay, this piece of equipment will either say that they do or they don't, but it's 50-50 chance that it may say that this is the evidence required that your loved one does need to go into a residential setting, and that's the buy-in. From that moment in time, they're like, fine, okay, let's do it, and let's run it from there. So yeah, we've had some lovely successes, and it's continued to work, and it is really pleasing to see it coming in without us having to push too hard now.
Nick, can I just add to
Excellent.
that? Sorry, because we're talking about the implementation right at the very beginning. And I mentioned about trust, and actually at the very beginning, we needed to have trust in the product, and to get that trust was how we presented the data, and how we presented the benefits of the product. So Kindy actually invested in 10 Lily units away from to prove the concept, to prove the data, so that we could show straight away that, look, this is the data that we can get, this is the impact we can prove. And that really helped, because once people could actually see the data and see the impact and see the benefits, that helped build the trust in the teams. And I think that step was really important for us.
Excellent. Thanks, Claire. Jackie, just coming back to you, kind of, around actually deciding where to focus and what where is the low-hanging fruit, for the approach. What was your thought process around where you wanted to see, or where you thought this could have the most immediate impact?
I'm smiling because my initial thing was everywhere. I mean, when you've got the savings to deliver in the way you have, it was like everywhere. I think initially, so straight away, we sort of discussed about the fact that we needed to do this in the hospital, because I spoke earlier on around the challenges with people coming out of hospital and there's no beds. I think the other element was then about the front door. So, what do we do at the front door and how do we work differently? But by doing that, that's to talk about, panel or the best practice forum effectively. by people coming to that and talking about, actually, as a professional, this is a decision I made, and we have really robust conversations there, that it sort of drove itself, as Rob said. So ultimately, I pushed, I have to say. So if a social worker, we said about a Lily unit, I'd say to Rob, can you go out with them? Can one of your team go out with them? So it was a joint approach between the social worker or social care officer and kindy. So actually what I'm trying to do, and this is a step that we need to look at, is it isn't just at the front door. It's when there's a change in care. So if somebody comes and says, actually, Mrs. Smith needs an increase in home care, what we tend to find in Medway, and I'm not sure what it's like everywhere else, is that increase goes in and stays in forever. So we want to get to the stage where actually we might put that in and put a Lily unit in as well for a period of time, so we can see that we bring that back down. So although the initial views were the hospital and the front door, it's actually naturally changed, and it now happens in different areas.
Brilliant, thank you. I think that takes me back to a conversation I had with Rob a few weeks ago around, the initial kind of thought process was that the kit would go in for that 6-week period, but actually what we're seeing now is that it's staying in. I think the average is 12-13 weeks across the portfolio, and this comes back to your point about trust, Claire, that it's been, that decision to keep it in is being driven by the practitioners and saying, actually, this is the value I see in this, and this is helping me and able to support that person in that environment. Rhiannon, from your perspective, can you give us a little bit of sense of that feedback and how that kind of is manifesting?
Yeah, I mean, an assessment takes as long as it takes. It could take 4 to 6 weeks. It could take 16 to 18 weeks. You can't put sort of a time limit on it, I would say. But I think to initially get a good understanding of what's going on with somebody, it does take a little bit of time. People do change, especially if they've been in hospital and they get discharged home. They might have a good turnaround, and their health might be better, and then the package of care can be decreased. In other cases, it might not be the case, and actually they do need more support going home. But I feel putting the Lily into place it's so helpful for that person as well, and it's the less invasive way of doing it. If care is in place and they've got people going in and out to see them, that's great, and I'm sure they have a log as to what they're doing and what's going on. But with the Lily, we can establish exactly what they are doing. Are they getting up out of bed? Are they going to the toilet regularly? Are they not going to the toilet so much? Maybe they might have an infection. There's lots of things that can be picked up. Are they eating well? Are they drinking well? Are they leaving the house and not returning? Or are they sundowning of a night time and opening and closing the door constantly? It builds such a good picture, and yeah, I think it's great. It's especially great, I think, for the patients that are being discharged going home from hospital. If they're going out under a certain pathway, and if they're going out with enablers, because it would determine if they do need something more permanent in place or not.
Excellent. Thanks, Rhiannon. Thanks. What we'll do now is we'll pop onto the next polling question, just to kind of keep everybody alert. And there's a couple of questions come in that are, whilst everybody's looking at this, so which is the most important for you as an organisation? Savings, cost, better allocation of time and resources, etc. We'll have a look at that. But a couple of questions that have come in. So Declan, you've talked about, yes, what is the tech and what does it do? So Lily as a product is here's one I made earlier. Here's a box of the sensors, essentially. So essentially, it's a box of sensors and technology that goes into somebody's home that uses AI and other types of machine learning technology to learn the patterns of behavior that are happening in that environment, and then enable to paint that picture as Rhiannon's just eloquently put in terms of what we're looking at. But essentially, that tech is based upon the sensors, which are relatively straightforward, but our platform that then has those tools and those bits and pieces involved in it. And then it's about how we create those outputs. So for example, Rob's talked about the reporting structure, and actually this is was really good for us in terms of how we built those reports. The reporting capability was talking to what was the output that was needed. So now our reports are focused and aligned to Care Act domains and what questions we can answer from a Care Act domain perspective, which is much, yeah, that's a massive evolution, as Rob will probably allude to, in terms of where people have come from, in terms of this has happened, a door opened, a door closed, but to be able to use that to answer the question of how was Mrs. Smith's behaviour at night in a concise format that is used, that relates to the Care Act domains and provides the right data points, is where the value kind of comes into play.
Can I just come in, Rob? I think it'd just be good to give a really good idea, because we talk about this from a savings point of view, but both, Rob, Rhiannon and Claire have alluded to that actually sometimes it absolutely determines that the care is needed. So we had a situation where there was a discussion about an elderly lady where we were being told that she was leaving her property constantly. She was in a flat. There were stairs. And risk of falls and so on and so forth, but we didn't have any evidence of that. Now we put measures in place to make sure she was safe, but we also put the Lily unit in, and that absolutely evidenced. I think she was opening the door about 70 something times, and within the space of a couple of hours, and was leaving the building. And so straight away we were able to determine that where she was living wasn't safe for her, because we couldn't make those changes. So just being very, very clear that sometimes it doesn't deliver savings. It is about making sure that that person is receiving the right levels of care. So there's a flip to it as well. But actually, as I said at the beginning, that's what we're here for. So it's delivering savings, but also making sure that people are receiving the right levels of care and giving that real substance towards the assessment.
Brilliant, thanks, Jackie. And that's very cool. That's been consistent. Our data showing over every customer we've worked with, we've seen kind of a breakdown of those that are using Lily to demonstrate the reduction in or no need in care, but actually there's still a percentage of that cohort that do require an increase. That's right. That's what we're here to, is to make sure that the resources are divided in the right way to the right places, and being a bit more dynamic than potentially we have been in the past. So we'll put the results up for the question. Yeah, so all of the above. 63%, improving quality, serving more people, current resources, better allocation, saving costs. Absolutely. I think Jackie, I think you just encapsulated what everybody's thinking. So that's fantastic. We'll just move on to the next slide. And there's a question here that's coming from Leslie. How long are you leaving Lily in for typically, and who is analysing the data? So that's kind of the point I was just making prior, in terms of, I think, Rob, I'll let you answer that question, because you allocated it to me better than I can do.
Okay. How long's a piece of string? But on average, as Nick said, it's about 13, 14 weeks. Some people have been in for 6 months, because the family and friends like the app, and because this person needs that level of overview to make sure that they're okay. With regard to reviewing the data, that's done by Kindy in the first instance, and then once the social worker or whoever's in charge, or the family and friends, are used to what the data is looking like, then they take it over themselves. But we will still have the final say as to what's going on. We're the fallback position, as it were. So yeah, I mean, and with regard to Scout, it's all about just passing that communication back.
Yeah, absolutely. And obviously scale comes, unless it was demonstrating the cost savings and the efficiencies, obviously the scale's not achievable within the current budget constraints. So that's, obviously a key thing, that it's got, what you're saying is that the results that are being driven from it being in and staying in actually are enabling more care it's a perpetual circle, isn't it? So right, brilliant. So just in this kind of context, so guys, you're now, I don't know if you realize this, but you're now approaching your 100th install in terms of kits in. So you've got, we're super proud of you for that. I think that's a fantastic approach in the time that we've been working for. Probably a Jackie question, as that kind of sponsor, the results that you're seeing, how's that giving you confidence that this is the right approach and driving the right outcomes? And how are you kind of talking to your senior colleagues about, this is how I'm doing this, and this is what this is why I'm doing it, and the value that I'm getting from this approach?
That's an interesting one. I mean, the money says a lot. That the amount of savings that we've delivered so far. Obviously, if we're talking about it from the sales point, I think we're over halfway towards the 1.25. You know, whether we achieve that or not, is yet to be seen. But we're definitely on a good trajectory. But it's more about, from my point of view, is when I'm hearing from the practitioners, when I'm hearing from the frontline staff, you know, when they're saying to me at they're in the best practice forum, you know, came to panel 7-8 weeks ago, we talked about putting a Lily unit in. The Lily, he's in midday. The Lily unit has been implemented. I'm coming back to panel because we still need to do this, but actually what the Lily assessment and the data is showing us is X, Y, and Z. So actually, it for me, it's about it's helping the teams in that decision making. But to be really clear, it doesn't do it instead of. It absolutely is part of the assessment process, but it just gives that assurance and that robustness. And as I said at the beginning, the part around what a family member might want as opposed to what we should or shouldn't be giving. So I would say from that impact perspective, definitely from a savings point of view, but I do see it as a service improvement as well, because we've seen a culture shift, and that's always the biggest challenge. Always the biggest challenge is to get that change in culture. So from that point of view, that's made a massive difference.
Excellent, thank you. And Claire, just coming to you, you're driving that implementation as the organisation, and what's the giving you confidence that having got to nearly 100, what's the confidence to get to 300? Jackie, we are going to smash through that savings barrier, by the way. I think, but yeah, Claire.
Yeah, I think for me, Nick, is seeing the impact. So we are now impact measuring all of the people that we're supporting. And we're reporting back internally as well as to Medway on that. And if I wasn't seeing we're not just measuring the financial impact, we're measuring the social impact, we're measuring the impact on family members, on unpaid carers, on how well we're supporting somebody to live independently. So we're measuring all of those items separately. If we weren't seeing positive impact, we wouldn't be doing it. And I know that what we've done so far has brought every person that we've supported a positive impact, whether it's been that the evidence that they need care or evidence that they can stay at home in with different support. And if I'm honest, we're not really scraping the surface yet. And so to push that forward and to reach more people, not only will we see more financial benefit for Medway, but actually our community is going to benefit from, as I said, from the individual who we're supporting, to their family members, to their carers, to their social impact. And if we weren't seeing that, I wouldn't be driving this forward, but we are seeing this really makes a difference to people's lives.
Excellent. Rob, just kind of into you. Obviously, you're driving that operational delivery. Can you give people a sense of the savings and the impact that's having? There's creating those. We've talked a lot about savings and talk about and we know that like I say, the value is the impact to individuals, but actually the thing that drives this is the ability to create that capacity and those savings in the first place. So can you give people a sense of how you've created those savings and what they actually they deliver? Jackie's mentioned the 1.25 million. Can we break that down a little bit?
Yeah, of course. I mean, the formula for creating the savings is not rocket science. People are coming so the workers are coming in to take the panel, for example, or coming into the forum and saying, this person needs a bed. So the cost of the bed to Medway is that amount. Let's call it £800. Actually, no, call it 1,000 because my maths is as bad as my English. So call it £1,000. The care calls going in at the moment, whilst the Lily goes in, is whatever it is, twice a day, 3 times a day, whatever. The gap between those care calls and what the bed would be is the cost saving per week. And then the amount of time that goes in before the decision's made that that person is either going to stay in a bed or stay at home is the cost saving for that individual. So we take that, and if the Lily stays in, that saving rolls on because it is still saving that amount of money. So I think since we started, as Claire said, the Kindy project with the initial 10 and pushing through to date now, so not this financial year, but it's probably about 10 months, we've just hit the £1 million for the financial year. So we're just over it's coming up to P7, so nearly 7 months. We're about £750,000. And that can be as little as sort of £80 a week, could be as much as £2,100 a week, depending on the level of care that that person would need, if it's a one-to-one or in a residential setting or a nursing setting. So that's how we break it down. But the key figures are, we've got a total of 1.25. That meant that we were looking to run about £30,000 worth of savings a week. It takes a little while to get to that 30,000, but I think last week we hit 45. And then exponentially, as we keep units in and increase the level of units, second half of the year means that if we don't hit the 1.25, I'll be very, very disappointed, as will all the panel.
Nick, can I just come in really, really quickly as well? I suppose just again, it comes back to that partnership working. So obviously, as Rob talks about this, people might be thinking, well, that's not savings, that's cost avoidance. And obviously, that's a really key thing. So lots of discussions in Medway, and I'm sure in other local authorities, about, you know, what is it? Is it savings or cost avoidance? But the whole part for me is about, you know, is reducing demand, you know, reducing the levels of care provided. The partnership comes to, it was really important that when Rob was looking at how were we calculating the savings, that my adult social care finance business partner worked together with them, so that actually from a corporate finance perspective, they were happy with, when we're saying these are the figures, these are the figures. So again, it isn't just a case of an adult social care point of view partnership. We needed involvement from other teams in the council, because I mean, Rob could just say to me it's £1 million and I wouldn't have a clue whether it was or not. I needed that ratification from our finance business partner.
I think, yeah, Jackie, I was going to say, I think that's really important. I think, kudos to you. I've seen, the relationship I see, and that strength of leadership is really important. Because we do see different approaches from different organisations, but having that clear, robust, this is how we calculate this, and this is the challenges I'm facing. I think sometimes people miss the fact that, as we said, demand is increasing, complexity is increasing, volume is increasing. I need to be able to, these things are coming. I can't stop them. This is how I need to deal with them. I need to be able to create the capacity in my system by avoiding those costs in this, and this is how I need to be able to articulate that. And that's just, I think that comes back to you in terms of kudos of how you've been able to take them on that journey as well from a leadership perspective. It's really, really important. I think there's a couple of questions that have come in terms of around the process and getting it signed off, and that kind of qualification piece, and obviously you guys used the proactive care fund that Lily put out into play. So Rob, can you just as you kind of led that approach, can you just give people a sense of the value that the proactive care fund gave you, and how you were able to kind of demonstrate that value back into the council and the signatories to get it kind of signed off, and the approach?
Yeah, I mean, once the project had been completed and we'd got the proof of concept, the Proactive Care Fund just gave us the ability to scale up massively. So it enabled match funding, I believe, Nick, I think that's what we call it. So the actual cost of the units over the year, the number of units that we wanted, it enabled us to go to we actually use the Better Care Fund through the JCMG. So we went to them, we put a bid through. But we didn't put a bid through for 1 year. We put a bid through for 3 years because we knew this was going to have to roll on. There's no point in doing it for 1 year and then stopping it. It would be ridiculous. So we put the bid through for 3 years. I think we were about 440,000, something like that, to cover the 3 years. Match funding came in. That match funding included the units, the subscriptions, all the training and everything like that. And then we were able to achieve the agreement from the BCF to get that out, and then we're going again next year and the year after. very
Excellent.
straightforward application form. So as well.
Smashing. Thank you, Rob. I am conscious of time and conscious that we've got a couple more bits to go through, and I want to get into the next bit. So let's go on to the polling question, but we'll also carry on talking at the same time. So the next bit was going to be, can you share specific examples? We've had one from you, Jackie, where you did that. So let's go to Rhiannon. Have you got any specific case studies, examples that you can say where this has really made a difference to the service user? And I'm not particularly focused on whether that was an increase in care or a decrease in care. I'm more interested in the outcome for the service user where you're able to deliver that.
Yeah, I have. There was a lady that was in hospital for a couple of weeks, an elderly lady. She had full capacity. She had a very caring, loving family. So the plan initially was that she went home with a package of care. She didn't have care before, and she went home with the biggest care package. So 4 calls a day, 2 carers going in. The family put provisions up in the house, so there was baby gates and stuff in place. I was worried about her going up and down the stairs. So we put a Lily into place just to see what she was doing in between these care calls and if she was actually doing okay or not. And she was doing very well. So originally it was that she needed assistance of 2 to be able to stand up and go to the toilet, which is why the 2 carers were put into place, and to put her to bed and all of that type of thing. But in between all these calls, she was getting up and making a cup of tea and going to the fridge and using the loo. So that was a good example. So the care was then cut down to 2 calls a day, but still with 2 carers going in. And still she was doing really, really well. And now she just has 1 carer going in the morning to help her get up, washed and dressed. So I would say that's a good example.
Brilliant. And do you think that without Lily, would you have been able to achieve that without the data from Lily?
Absolutely not. No way, because the carers wouldn't have been able to tell us because they're not there in between the care calls, and the family would have told us that she was not managing. And I don't think it's because for any particular reason, but I think it's just because they cared about their mum and wanted her to have the best level of care possible. But at the end of the day, it was also about keeping her independence and about what she also wanted and what she could do, and we could evidence that with Lily.
Brilliant. Excellent. Thank you, Rhiannon. We'll just put the result up for the polling questions. Would you like to consider a similar solution for your own organisation? I say very likely 42%, somewhat likely 33%. So that's 75% saying, that's something that they're considering. So thank you very much. Just kind of, like I say, massively conscious of time. Just want to come to some kind of final thoughts. But one of the questions that's come in, Jackie, I think is really important for we get your context on this. If you could, in your summary. So what do you think the biggest barriers are to this sort of assistive technology being scaled at a national level?
I think funding obviously is going to be a considerable element of that. I think everybody wants to do this, but I don't know any local authorities that sit in with pots of money knocking around. So whether that needs to be looked at, again, you talked about the proactive fund, but whether that needs to be something that comes through from central government. I think the change that, if I'm going to be very honest about the focus from the NHS to councils, there needs to be a shift there as well. The continuous element around, it feels like, if I'm honest, sometimes that's what we're here to do, is just to support people coming out of hospital. Very important. I'm not considering that's not the case, but there needs to be a shift. And I think definitely around the prevention side of things and that real focus on prevention as well. So I think there's a number of things. I think it's being a bit brave if I'm talking about it locally. You have to sort of be brave. I keep saying to my team, let's be ambitious and bold. And we were lucky that we were in the position that, as Claire said, they funded the element, and then we've got it through the Better Care Fund. But But I think that recognition about local authorities needing additional funding is going to be the key thing to support us looking at it from a more national scale.
Thank you, Jackie. Claire, kind of final thoughts from you.
Sorry, I couldn't get you off mute then. I think one of the challenges that we found right at the beginning was around resource, and I think we're very fortunate that Medway have Kindy, and I might be a little bit biased because we were able to support on that resource, and we were able to support with the initial assessments and continue to support with the monitoring assessments. I don't know any adult social care team that have got much capacity, if I'm honest. You know, everybody is really busy, and taking on something new and implementing something new takes time and takes resource, and I think we've added a lot of value to Medway Council to be able to do that. But ultimately, all of this and all of our successes have come down to, and Nick, you mentioned it right at the beginning, is partnership working. This is, you know, Lily for us has not been a supplier, you've been our partners. And we've worked together with you and with Medway to make sure that this has worked for the best of everybody involved. So for me, the whole basis of all of this is down to partnership working.
Excellent. And Rob, with the operational hat on, final thoughts from you?
Yeah, I mean, totally agree with both Claire and Jackie with regard to that, especially with regard to the partnership working. I think that what comes out of it as well is that Lily inadvertently supports other partners, because we're in a lucky position where we can signpost back to Medway Social. We can also signpost out to the voluntary sector. So if we see something that isn't going right, or something that can be solved, that the family wouldn't even know where to think of in the mire of where all these services sit, we can signpost that as well, and Lily's highlighting it, and we can pass that on, and that takes pressure off of the council budgets as well. So I think there's a real wraparound holistic view of it. And the resources that we've got 3 people looking after this amongst other things, and they are all very, very busy. It does make me wonder how we used to cope when it was just me.
Brilliant. Rhiannon, it kind of comes to you last. Just give us a sense of your final thoughts and where you are today as to where you were 12 months ago, when probably Lily wasn't necessarily in place.
Much busier, I can tell you that now. But no, it's good. It's all really positive, and like what Rob just said, I was going to touch base on that as well. With the Lily and building up a picture of what's going on, we can signpost. There are other organisations out there that can help support with this and help with adult social care. You know, if somebody doesn't need a large package of care but actually needs a befriending service, we're able to do that, and I think that's really important too. But yeah, all round very positive.
Excellent. Right, so thank you to the panel. You've been excellent, and I think it's great for everybody on the call to be able to get that, like I say, the overview from Jackie as that leader, the operational and the delivery piece from Claire and Rob, and Rhiannon on the front line. So anybody got any additional questions, please do come to us. We're more than happy to field those questions and come back to you. If we've missed anything, again, we'll try and answer any questions that we might have missed in the chat as well. So more than happy to engage. Anybody wants to talk to us, we're open to those conversations, and hopefully we can demonstrate that we're about a partnership. The Proactive Care Fund is open for applications. There are, and I think Rob kind of alluded to this. To make this sort of thing successful, you've got to be brave, you've got to commit, and you've got to, so the minimum kind of volumes that people are looking at in that is this minimum 60 units, and it's a minimum of a 12-month commitment. The reality is, you probably need to commit for bigger and longer, because actually that gives you the volume and that cultural change opportunity, and the other bits that Jackie's kind of alluded to that really need to happen to cement the approach and deliver the outcomes. But at the end of the day, this is all about delivering outcomes for the service users, and making sure that resources are allocated in the right way and as they're to the best efforts of everybody involved. So have a great rest of your Friday. Those in Australia, hopefully your glasses of wine are topped up, and you've been able to to sit back and relax. But listen, have a great weekend, everybody, and thank you for joining us this Friday morning.